Thank you.
Good afternoon, Dr. Ajay, and it is glad to see you online. And we are meeting after a long time. And the audience, I just wanted to introduce Dr. Ajay. We were colleagues in Pune, and we worked on many projects and put together. And we used to have very stimulating discussions, which was very helpful for me to clarify many of the issues. And I know he is a specialist in looking at the social aspects of tourism and particularly research. And he is a master in research method R. And thank you for inviting me for this. And I am delighted to interact with you. Good afternoon and good evening. So there's a time difference between there's a time difference in Australia and India. So anyway, initially I was thinking that this will begin as a kind of an interactive session. And at the same time, because the limitation of our the digital medium, I may go for an introductory lecture. Then we can have a few questions either through the chat session or through you can unmute and ask question. And also I've been told that the audience, most of the students are the +2 students, or that's the level of the students. So my presentation is initially prepared for a graduate level students. So I'll try to present it in a very simplified language. If I'm not clear on certain areas or certain concepts, please feel free to ask me during the question and answer session. And as an introduction, what I want to say is that any discussion about public health, particularly public health related teaching, education, the courses which we can do, and the job opportunities are mostly after you do at the master's level. So that way, I assume that the audience is a +2 level. So you have a couple of years more to think about public health as a possible area of your interest, and also to look at what are the job opportunities. So this is just keep this as a background information, just as a general knowledge, and a brief introduction to public health from a very basic introduction. And what job opportunities you may be able to take up, whether you should join an MBH program, whether a bachelor's in public health or a master's in public health. So you have considerable time. So you can think about it. So consider this as a generic attending a session, and which may give you some new ideas about a domain knowledge called public health. And what I want to talk to you about is broadly to introduce you the public health, what is the definition and what's the background of public health. And most importantly, to understand public health, quite often we contrast public health with the clinical medicine or a clinical health. We know about when you talk about health, our understanding is normally hospitals, clinic. So this is what, I'm sorry, can you remove this? There is somebody is disturbing this session. Ajay? Dr. Ajay, can you hear me?
Yeah, yes, I'm doing it right away. Yes.
Yeah.
Yes, right away. 1 second.
I'm sorry that, I'm sorry for this intro.
No, just a second, sir.
Yeah. Okay.
No, still
Yeah.
not okay.
So when I talked about public health, then to understand public health, there is a concept called burden of disease, because the disease creates certain burden in the society. So that's another way to look at public health. Public health is normally used to reduce the burden when the diseases collectively creates burden on the society. So one of the major function of public health is to reduce the burden. So this is another point I wanted to introduce. And I'll briefly say what are the public health systems and how you analyze it, and what are the determinants, what determines health. So what factors contribute towards health? Because so that's one of the area, the clarity will give you some idea about what are the opportunities for your job opportunities in health, because what contribute towards health is an important area to understand to reduce the health impact or the factors which is impacting health, or minimizing the impact on health. So this is another area of intersection about understanding health. Then there is increasingly there is another new idea is coming up. Health is in all policies. or health is involved in all aspects of human life. And how do you understand what is its implication? And the next is about what are the skills you may have to require, you may have to pick up to becoming an effective public health practitioner or a public health, a person working in the public health sector. And also one of the major preoccupation of public health practitioners is looking at how to reduce health inequity. Health inequity means some people get health benefit, some people will not get health benefit. Some people may get health advice, some people get access to health care, some may not. And this is based on many aspects like your linguistic history, your linguistic capacity, where do you live, your financial condition, your family condition, where do you live. There are different aspects of contributing towards public health. So I'll just introduce what we call it as determinants of health. And also I'll just give some example from the pandemic which you're still living with, the COVID pandemic. And that gives a framework to understand public health in a new perspective. So this is the overview or outline of my presentation. Next slide, please. So in this presentation, I might describe what is public health and also what are the core functions of public health. That's the second aspect of it. And the different stakeholders in the field of public health. Stakeholders means who are the key players and who does what. So that is the next part of it. And also I describe what each one is doing. Then I list some of the determinants of health. Then how individual determinants are impacting on health and well-being. And finally, how the COVID pandemic is impacting on public health and how to understand from a public health perspective. So this is broadly the objective of this presentation, the learning objective of my presentation. And when we look at public health, we had to look at what is the definition of health itself. I don't know if anybody is aware of the definition of health. Just keep in mind. Very interestingly, the definition of health is put forward by World Health Organization, WHO short. WHO is an international agency, United Nations agency, which is focusing on health of the global population, health of all the countries, and health of the humanity in its totality, beyond the boundaries, national boundaries, political boundaries. So that's the agency designated by the United Nations as a lead agency for health. And the WHO defined health as it's a complete physical, mental, and social being, and not merely the absence or disease or infirmity. So this is the definition of health. Health is the absence of physical, mental, and social well-being, and not merely the absence of disease. Because this is not about clinical medicine, it's not about hospitals, it's not about specialization, it's not about huge institutions. The health is improving the well-being of the people in different aspects, physical, mental, and social context. And this is also not merely not having disease. So this is a simple form of health. Those who are trying to understand the concept of public health, maybe this is what you remember. Health is not necessarily about hospitals or institutions. And in the public health teaching, sometimes we refer the different factors contributing towards health is not in the hospital, or health is outside the hospital. The factors determining the health and well-being are outside the Ministry of Health. So this is one of the leading understanding about health. And this clarity is also contributed by COVID pandemic, because very few only some percentage of people can get access to treatment. But how do you prevent? That is not a clinical issue. We wear a mask is one of it. And hand washing. Hand washing is not necessarily a clinical practice. That's a very basic social practice. So the definition of health is about the well-being in its totality, and not just merely the absence of illness. So this just keep in mind in your inquiry about to understand health and well-being. And the next one, and also health and public health. Public health is a science and art. And underline, public health is a science and art of preventing diseases, prolonging life, and promoting health through organized effort. You promote health through organized effort, and also making informed choices in the society, organization, public, private communities, individual, and the government. So this is the definition of public health. And interestingly, this definition was put forward in 1920. So almost 100 years ago, they defined public health. So the public health is, again, is an organized effort to improve the health and well-being of the society. Just think about in your own environment, what are the activities which is being implemented by your university, your college, your school, your community, your panchayat, to improve the health and well-being of the population? Are there any at all? Just try to remember for a few minutes, whether are you familiar with any organized effort to improve the health and well-being. So these are the public health. So that is the basic definition of public health. And next slide, please. And that involves the process of mobilizing and engaging the community, engaging the local community, engaging and also seeking resources, international resources and national resources, and also creating the condition and which are contributing towards people remain healthy. And also, basically, public health aims to maximize the benefit for the largest number of the people. So this is a major contrast between clinical medicine and public health. Clinical medicine is contributing towards improving the well-being of a person, whereas public health is looking at the well-being of the community and the population in its totality, what effort you need to do to improve the society's well-being. Whereas clinical medicine look at how to improve the health and well-being of a person through the intervention. That's the clinical intervention, diagnostic intervention, and they diagnose what may be the clinical condition and provide prescribe a medicine. Whereas public health, you look at what are the factors contributing towards health in its totality, health in the wider community, and then you come out with the programs to make changes in that setting. Next one, please. And this slide is looking at very clearly the definition between clinical health and public health, because this is one way to understand, to get clarity about public health, to introduce it as what is not and what is a clinical health. The public health model is focusing on society, and the public health is focusing on disease prevention, and the public health is focusing on the analysis of society based on the disease for the disease prevention. And the public health is also about promoting health and well-being. And then you come out with, you design intervention to improve health and well-being. And also you try to modify social behavior and human behavior. And finally, the interventions are being organized or implemented by private and public, but largely by the public sector, by the government. So this is the public health model. Whereas clinical or medical model of intervention is looking at focusing on individual and patient in the hospital. So this is the idea of a clinical medicine. But when you look at, this is only tip of the iceberg of the disease, because very few percentage of people are lucky to have a hospital admission even when they're seriously sick. So this is the clinical medical models of looking at care. And the clinical medical model is based on the diagnosis and the short consultation. None of the consultation with a physician is quite often not more than 10 or 15 minutes. Whereas public health intervention is a long-term intervention. Clinical intervention for one person's disease and illness is based on very short-term thing. Then the clinical intervention, that may be injection, that may be medicine, it may be a clinical procedure, but all focus on individual. That's the important part of it. And you provide medical care for a person-centric medical care. And mostly this care is taking place in the hospital setting and the specialized setting. And quite often, the emphasis on care is largely on private sector, but in some cases it's public sector. Whereas in a country like Australia, the major part of the care is provided by public sector. Government hospitals are providing the best care and most of the care. The private hospitals are providing care, but that is mostly to people who can afford to, those who have a private insurance or private coverage. So this is another small aspect of public health in the developed country and the developing countries. Next one, please. And in the public health, there is another concept called burden of disease. So the disease is creating burden, financial burden, social burden, and other psychosocial burden in the society and the patients and also their families. So this concept of disease burden, and it's a total of all the problems created by health condition. And this is quite often this is measured by financial cost, mortality cost, morbidity cost, and other indicators. Morbidity means the disease, how many diseases, what is the extent, what is the epidemiology of disease. Morbidity is how many people are dying because of certain diseases. So the major indicators to look at to describe burden of disease, looking at two concepts, that's mortality and morbidity. How many people are dying because of the disease? How many people are ill, means hospitalized, or they are out of circulation because of the disease. So these are the two major factors used to understand the burden of disease. And there is a calculation, there's a formula for calculating the disease of burden. And it's called a quality of life adjusted years, called QALY. But I'm not getting into the details of how to describe and how to measure the disease burden. I'm just introducing a concept. When you try to understand public health, remember, there's a concept called disease burden. But I'm not describing the details of it, just introducing a concept called disease burden. And also the next is about, when you talk about public health and opportunities for job, we have to look at what are the essential public health services. Because if you look at carefully, the jobs quite often will be associated with these essential health services. One of the major functions about public health is monitoring the health, monitoring the disease. The monitoring may be through systematic collecting data about disease, illness, the spread of disease, epidemiology of disease. So monitoring health is one aspect of public health. Then social diagnosis and investigating the cause of infection. So the COVID pandemic wave is not necessarily clinical exploration. We look at social aspects of who gets infection, what frequency they're getting it, are there any social condition, are there any ecological condition, environmental condition. All this inquiry is the diagnostic and investigation. That's one major aspect of employment opportunities. As investigators and epidemiologists, as also disease surveillance officers. So these are certain opportunities in public health job opportunities. So the next major function is about informing, educating, empowering. Sorry, just please go back to the next one. So the major public health services is about informing, educating, and empowering. That this is also a major area of employment. Educating about diseases is a major source of employment. Mobilizing community partnership, because disease cannot be addressed by one group. There are different groups like patient group, doctors group, the pharmacist group. So all this collective action is important part of public health services. This is another major area of employability of public health students, public health practitioners. And also enforcing law. The public health is also largely related with public health laws. Certain laws are implemented to make sure that diseases are reported. Disease spread is controlled through law. And law and health is a major aspect of public health interest. And this is also an opportunity for employment. And I just go to the last 9 and 10. Evaluating the public health programs is a source of employment. Evaluators and also data collectors, that's the scope for employment for the public health students. The last is about public health research. If anybody is interested in research part of it, public health is a very fertile ground for doing your creative and innovative research. And research area in public health also an opportunity for employability as research officers, research managers. And at the senior level, they look at different aspects of disease, even PhD doctoral studies, and to lead the research at the highest level through public health. That's a major area of opportunity and area of employment for the public health students. Next one, please. When you look at who are the key players in public health, I mentioned earlier there are different stakeholders. So the key aspect which is collecting, bringing everybody together is about creating and ensuring conditions which improves the population health. And they are the wider community, clinical care delivery systems, employees and business related with health, the mass media, social media. So they play a critical role in promoting health and well-being. Academicians, they're teaching, they're training public health students, they do research. They also contribute towards policy making in public health. government public health infrastructure. So these are the major players in the public health. And also from the employability point of view, remember the employment and public health point of view, these are the areas, again, employment opportunities are coming up. So this understanding about who are the key stakeholders, who are the players who will contribute towards better job search opportunities and also employability opportunities. Even now, if you're planning to take a public health in the long-term perspective, you can keep an eye on these are the areas in which the job opportunities may come up. You can start monitoring it. And also you can talk to people from different sectors to see that whether there are employment opportunities from their interest and their education, and also to think about specializing in public health within 3 or 4 years. So this gives you some broader idea about who are the key players in the public health system. Next one, please. And also what contribute towards health of a population. Next slide, please. So broadly, when you look at this diagram gives social and social characters of the total ecology is contributing as a major determinant of health. Then biological factors, genetic factors, the health behavior of the population, and also the access to medical care. So these are the major aspects of them which impact health of a population. If you look at social aspects and the structural, economic, there are many sub-components. These are the major contributor towards health and well-being, rather than, even though our general perception is that hospitals are the major contributing factors to reduce or improve the wellness. That is not the case. Next one then. So broadly, what we call it as social determinants or the structural determinants of health. So social determinants are all the social factors which is contributing towards health, like the clarity of how clean the air you're breathing, how polluted your air is breathing, the water, how clean the water you're drinking, the transportation, how accessible it is, and the roads, how safe it is, because road safety, road accidents are the major cause of death and illness in the Indian context. So these factors, what we broadly call it, are social factors. Whereas within the social factor, there is another set of factors called structural factors. Structural factors means the social relationships are more or less stabilized. So those social relationships are called structural relationships. For example, religion is a social structure. Education is a social structure. Laws are a social structure. So certain social conditions, social relationships are established, and they play a critical role in the health and well-being. Like education, you have access to information, access to knowledge, and your access to healthcare facilities. This all contributing towards health and well-being. Like this, there are social determinants, structural determinants, economic determinants, and also there are now environmental determinants. Now increasingly, the environment in which we are living, the climatic change and the climatic crisis is to great extent are contributing towards health and well-being. These are not contributed by the individuals. These are outside their capacity, outside their decision. And the decision taken in some other country may be impacting on your health, because the pollution, the polluting industries are an outcome of a policy decisions. But at the same time, the impact on the population may not have much resources or much power to do away with that factors which is contributing towards the health and well-being. And next slide, please. Next slide there, I try to list what are the factors contributing towards health. Income and social status is, as we know, that's a major factor contributing towards health and well-being. Social support network. Social support network means when you need some advice, do you have a support system to fall back? So this is what we call social network. You need to get an advice on your schooling, your education, your decision about which doctor to see, whom to see, when to see, all those, that ability to get information, ability to get advice from your immediate environment, that's called social support. This social support may be through a kinship, your family relationship, your caste relationship, and also your political relationship, and your friendship relationship, your education, institutional support. So cumulatively, the more you have social support, you have a better access to healthcare. And this social support network is an important factor in other dimensions of society also. See, for example, most of you are now a member of a Nalanda Institute, Nalanda, this academy. Access to that academy itself, you contribute towards your social support network. Now, suppose somebody who got access to this institution, they have a better social support network that will lead towards the better well-being in the health sector, social sector, economic sector. So this is increasingly we have to understand that how do you improve your social network? So, and I would comment on your friends, your teachers, you created this Nalanda network. This is creating social network for my understanding is that mostly from the students coming from the rural areas. So those kind of institutions contributing towards health and also their social capacity to survive and do better. This concept of social support is not understood even in the health sector or outside. So, but this is a major contributing factor to the health. And next is about your literacy, your education. As we know that the better education can lead towards better health access. Then employment and working condition. We notice that those who are employed, they have a better opportunity for healthcare because of the income status changes. And lack of employment contribute quite often towards mental health issues and also lack of resources to invest on your own health and well-being. And the social environment in live. For example, suppose you live in a very thick, very crowded environment that may negatively contribute to your health and well-being. And also quite often, sometimes the very crowded place also can lead towards social conflict, violence. And that is again negatively contribute to your society. And the physical environment, for example, you live in a better housing condition. If you have a well protected from the environment and your house is protected from the cold and heat, you have a better health. And some people, if you are supposed living in a substandard housing condition, that can negatively impact on your health. But this is also an important aspect of understanding health and well-being. And also being a child, when you are a child, how your growth is contributed, how it was taken place, whether essential support from maternal support and maternal care was contributed. That is an important factor about your future health condition. Because today we know that some children, they're born with diabetics during the gestational period, and the mothers or the healthcare providers, they may not even know about it. So my point is that your early childhood experience and the health condition going to impact on your future health and well-being. So this is another important aspect of understanding health. The next is about gender. There is the health care facilities, male and female, that has got a different impact on your health and well-being. And genetically, we know that women are likely to outlive men. The life expectancy is more for women. But whereas when the life expectancy increases quite often, the quality of life of elderly women, they suffer in relation to the quality of life of men. Maybe there are many factors, but why I'm suggesting these different factors, to give an idea that health is impacted by various social, ecological, economic, there are social factors. So understanding about this determinants is an important aspect of understanding health and well-being. Also from the employment point of view, you can understand that these are certain areas in which public health related employment opportunities also coming out. And the next slide, please. And public health today, there is a concept called health is in all policies. And this is also to understand public health. For example, you may think, I can give an example about it. There is a linkages between how your roads are designed, your highways are designed. It has got an implication on your health and well-being. For example, you just imagine the road, your street you walked this morning, whether that street has got a footpath. If there's a footpath, there is a likelihood of the lesser road accident. And also we know that footpath, if it's a safe footpath, you can walk, and walking is part of the day-to-day exercise. So just one decision by the government that all the roads should have footpaths, safe footpath, that itself can contribute towards health and well-being to significantly to that immediate community by reducing the road accident and providing a safe place and space for your physical activity. Just give an example about how road design is contributing towards health. So that way, any policy, you take any policy, that policy has got health implication. So this understanding and this analysis is becoming a major part of the employment opportunities of the the public health professionals and students as well. You just imagine in any of the social policies, education policies, how that is impacting on health. Because in many of the schools in many countries, there is a school health program, and all the school children are routinely subjected to health checking and health diagnostics. Maybe I don't know whether the Nalanda Institute, they provide that support for the students, because you get a captive audience of students, and their health and well-being is routinely examined through an institutional setting. This is one of the major contribution of education institutions for contributing towards health and well-being of the young population. And so what you have to keep in mind is that any policies has got a health implication. So this is what your take-home message, but you try to relate within your day-to-day life, how that is impacting. I know this concept may be little above the normal conceptualization, normal comprehension in a +2 level education. Plus, just think about it. I just wanted to stimulate your curiosity to understand public health. From that point of view, I'm just presenting it. And also, how to promote health. Promoting the health is done by the government through various programs, various policies. Any programs and any policies by the government should have a component which promote health and well-being. For example, any school program, now we have midday meal is a standard thing. Similarly, all the schools should have a school nurse which will monitor the health and well-being of students on a regular basis. And also, if they need a diagnostic support, that could be given by the school. Suppose all the school children in India are diagnosed and routinely examined, that itself can contribute towards health and well-being of the country itself. And take any aspect of the public policies that has got a health impact. So this is what you have to remember then. And next slide, please. And increasingly, the government is using tax to improve health and well-being. For example, there is a greater tax on alcohol. Alcohol, we know that alcohol is widely used for altering the consciousness, but it doesn't have much of a health benefit. But it's used not necessarily health benefit. There are other social aspect is contributing towards alcohol use. But alcohol is increasingly you tax to reduce the consumption. So similarly, the sugary drinks. We know that there are sugary drinks like a Coca-Cola or a Fanta. So this doesn't have much of a nutritional value. But whereas the sugar content is contributing negatively towards health and well-being, because of that, it is taxed. And similarly, the fatty food which are processed, multi-processed food, which are taxed. So the tax is increasingly used to control or contributing towards health and well-being. So this is also an important area of employment opportunity. How do you monitor the taxation as a tool for improving health and well-being? This is, and if you're interested in the long-term involvement in public health, think about this from the relationship between tax and public health, just to initiate your curiosity. And most of the time, the tax is focused on alcohol, tobacco, candies, drugs, soft drinks, fast food, coffee, sugar, and also to a large extent, the gambling is also an addictive behavior. So then they are taxed. So the tax and public health, these are some of the examples I gave. And the next one, please. So I'll just look at what are the essential skills you require for the public health practitioners. If you're looking for the job opportunities, these are some of the skills you may have to eventually acquire. As a leading public health practitioner should have these skills. Let me explain it. Analytical and assessment skills, that is your research skill, that you have to pick up how to analyze, how to assess through research and through other analytical tool. That's one major aspect of a public health employee. Then policy development, program planning skills, how to write public health policies. That's an employment opportunity. Public health communication through social media, through other print media, so other visual media, how to communicate health. You can see that health-related messages coming through TV, social media. So designing and creating that is a major aspect of employability in the public health context. Then how do you practice public health? What activities you can do? The next is about public health science skill. Public health is a science. So that science requires a scientific understanding about disease. the causes of disease, and again, the monitoring skills of the disease, and the diagnostic mechanisms of that, then understanding about diagnostic tools, and procurement of the diagnostic tools, procurement of the medicine. So that procurement itself is an offshoot of the public health. Now, increasingly, we also talk about logistics of public health. We know logistics means the trucking industry or maybe the transport industry. This is traditionally understood as a logistic industry. But public health logistics is becoming an important aspect of employment opportunity. For example, you may be interested in a drone, how to fly a drone. The drones are increasingly used for the public health. And those are interested in satellite technology now, increasingly, satellites are used for monitoring the health of the population. Again, another area of employment opportunity. And the financial planning and management skills. We have specialist health economists nowadays. So if you're planning to have a very decent employment in public health economists, health economists are a major source of employment opportunities in the public health. And the last is leadership and system thinking skills. How do you design? And this also including the public health faculty, teachers, researchers, and the public health professionals, those who teach public health students. So this is also another employment opportunity. So these are some of the essential skills of the public health practitioners. So I just listed randomly. And the next one, please. So if you look at, next slide, please. Yeah, when you look at different functions of public health, one of the critical functions of the public health is, the previous one, One of the critical aspects of public health is, one of the major challenges in public health is the concept called health inequity. Health inequity means the distribution of health services are not uniformly distributed. It may be because, suppose you are in a remote settings, in a remote village, your access to healthcare may be reduced. And also, if you have enough income, you may not get better services. And also, if you have enough knowledge, you may not have better services. So health is impacted by what we call it as health inequity. So one of the major demand on public health professionals is how to reduce health inequity and create certain level of equality in the healthcare system in terms of access to healthcare. You know that in Indian context, health inequity is one of the major drawback of the healthcare system. So public health practitioners, public health students are increasingly called upon to identify the health inequity and also to come out with programs to reduce health inequity. And also when you look at the magnitude of health inequity, we have to remember that every day about 16,000 children die before their first birthday, their fifth birthday. Before 5 days, 16,000 children die on a daily basis. So these are increasingly, to large extent, these are preventable deaths, because child death could be prevented through various aspects. Today, we have the knowledge, understanding about why the child death is occurring, and we have the tools and technology to reduce this significantly. And this is also another major challenge of public health. And also, we have to remember that 87% of the premature death due to communicable diseases occur in poor countries, low and middle income countries. And also, this health inequity is not a new value neutral aspect. Health inequity is contributing towards resource inequity. The poor society produces poor economic outcome because a poor worker produces poor result. And also poor health is contributing towards the economic contribution from the community. Otherwise, they would have used it for education for the children or maybe nutrition for children. But the disease can reduce the investment in other areas of progress for the family. And also, the persistent health inequality is contributing towards low social development, low economic development, no education attainment. So these are some of the major aspects of the health inequity, which is increasingly called upon by the public health professionals to deal with it. And also, we know public health, one of the major challenges is the COVID pandemic. And the COVID pandemic is contributed towards almost, I think 17 million people died, and almost 65 million people are infected when you're talking about globally. And still, we don't know what's economic consequences of public health. For example, most of the countries, they locked down for 2 years, and that contributed to the education deprivation and also health deprivation and the serious economic consequences. We don't even have the tools to measure the economic impact of a major public health challenge of COVID pandemic to understand how it contributed to our society and well-being and the long-term consequences. And this itself is challenging the need for looking at public health more carefully. Whether we can avoid this kind of situation, an answer should come from mostly from the public health. So any of you want to look for the Nobel Prize in medicine or society, maybe think about a major public health contribution, not necessarily clinical contribution. For example, how to reduce the tuberculosis, how to improve child survival. So something of this sort, if you can come out with, maybe that could be one of the source of Nobel Prize or maybe global award. So in nutshell, public health is an opportunity for employment, and the public health is also a very challenging area of a domain of knowledge. But what you have to remember is at undergraduate level, that degree BA in public health is offered by very few universities. There are 80 universities offering masters in public health, and about 40 odd universities or institutions are providing doctoral program in public health. And so this is in general, this is my introduction to public health. And also subsequently, I just mentioned about what are the employment opportunities. As a long-term career opportunities, I would strongly suggest you think about the possibility of public health as one of your career opportunities. I'll be happy to interact with you in future if you want to get additional information. And thank you for your attention. Any questions? Dr. Ajay, just I'll leave it with you how you wanted to take it forward. I think you can, thank you.
Yes, sir. Yes, thank you. Yes. So if we have any questions, so participants can, those who are on the Zoom, so you can write in the Zoom, okay? And those are on the YouTube, so you can write your question in the comment section, and then I can read the question on your behalf. Okay. Or if somebody want to speak or interact, and so then you can ask me to unmute, and then I can mute you. Okay, being time, so when you are looking for just a second. Okay, so we got first person who raised the hand. Okay. It is okay by mistake, I guess, on your side.
And I just saw one comment. Some people didn't understood, and my apologies. Hindi is, I'm not fluent in Hindi to speak to that extent to give a lecture. That is my apologies. And I know there's a message came, they couldn't follow. So I'm sorry about that.
I say sorry because I think the Zoom link went to someone who was, maybe in some different environment, and he sent some wrong comment. But yeah,
no, that's all right. But I think it's a general concern. This is a general concern that some people may not have understood English as a spoken on a day-to-day basis. I understand that, but I'm sorry, I am unpad in Hindi actually.
Okay, no problem. Okay, but I think, sir, your several points about the public health. Of course, health has been always a concern, but I think after the COVID, people became more serious about health as well as the government. And I think we will see more opportunities, different types of roles and positions, especially in the healthcare sector, and especially in the public health sector, not just the medicine.
See, maybe our understanding. There's somebody asked whether I can ask a question. Of course, they can ask a question, but let me just add one point. We talked about health in a different way. For example, health is the security. Earlier, when you talk about security, we think about military, national boundary, the war-related equipments. But today we notice that security is important part of the health is the security. So you should understand and invest health as equivalent to the investment in national security, because health is a national security. So that thinking is shaping up now. Because somebody asked whether they can ask a question here.
Okay, so yeah. From the audience, if you have any questions, you can.
Yeah, please ask. Yeah, right.
Yeah. So there is one question from one student. He is a student at TIS of Public Health, and he is saying that what should I do as extracurricular to getting into health data science field or public health research?
Okay.
So his question,
See,
yeah.
I remember that somebody asked that question earlier before when I joined the session. See, this lecture was not necessarily to the master's level students. This is a very basic introduction to public health. But my answer to that question is, see, now, number one, you have to identify what are the major national and international agencies focusing on public health. And that's one of the major aspects of it. Second, if you have a master's level student, you have opportunities for reaching out during your internship and also your final year thesis. So ideally, you should reach out to the international national agencies focusing on public health. And the other issue, I would say that you actively try to cultivate a very particular area of interest that will contribute towards focusing on research in public health area. And it's a matter of your long-term homework and using through your internship opportunities and personally reaching out to work in these agencies as a volunteer, or you focus on your research itself on these agencies and their activities, and keep a very general interest in public health related teaching, training, public health information, and you yourself cultivate an area of expertise, an area of interest in public health, and you could keep an eye on the public health agencies again. And you focus on or zoom or identify a few agencies which you want to do on a long-term base follow-up. So this is my random reflection about how we can cultivate your public health career opportunities. But today's session was not directed towards a high level of discussion about the job opportunities. It's a very generic, basic introduction. If you need any follow-up question, I can ask, then I can explain it further. And also, if anybody wanted to have personally want to ask a question, please feel free to ask me. My email and Twitter, my other contact details are with Dr. Ajay, or maybe I can also send you later.
Yes, sir. So one question is there from the YouTube comment. So the student want to know the important, like how they can collaborate research and public health.
What I heard is that how you can collaborate on research and public health, right?
Yes, yes.
Okay, see, so public health research is one of the major element of employment opportunity in the broader sense of public health, because any public health policies, you need solid research behind that. So that way, just focusing on their area of interest, you're cultivating one particular area. For example, take the case of how to reduce TB in India, the burden of disease from point of view, or how do you look at what are the preventable disease among the children and child deaths? That's another area of interest. Or in today's context, non-communicable diseases. What is the burden of purely how to reduce heart-related diseases? What are the intervention possibility? What are the opportunities of prevention and control of diabetics? Because diabetics disease, the condition is becoming uncontrolled in the Indian context. So you cultivate a particular area of interest and look at what are the research need is existing. And also remember, in public health, there are constant public health research output is coming through various publications. So monitoring some of the leading journals are an important aspect of to keep an eye on what is emerging in the public health. And in that process, you also zoom and keep your interest in some few areas with the possibility of your long-term interest in that research area. Thank you.
Yes, sir. So we have the next question, which is which are public health research areas in future? Like if you see the future, like COVID is there. So what are the future research areas possible in public health?
See, I would say that the health economics will be one of the major area of focus. For example, what is the cost of disease? That will be another major issue. And what is the economic benefit of preventing diseases? For example, what is the economic benefit of preventing diabetes in India? But the economic benefit of preventing diseases and the cost benefit analysis of investment for public health and the benefit of public health. So this will be one of the aspects of it. And the second aspect is, I would say, the impact of environmental crisis on health. There are nuances of how the environmental change is impacting on health. That will be major focus of research in future. Is, for example, take the case of air pollution, how that is impacting on health and well-being from a public health perspective. And what are the intervention strategies to improve the climatic condition? And environmental crisis and health will be one of the major the research in the future. Then, if we look at the food security and nutritional crisis, how that is impacting on health. So that way, I would say randomly, these are some of the future research need in the public health. But this also varies some location because certain region, depending on what are the local conditions that contribute into health. For example, extreme drought condition and what is impact on public health, and the occasional flood and the natural calamities, how it's impacting on health. And increasingly, the people moving from one section and the population mobility as a refugee, as internally displaced people, and this has got health implication. And this is also require a very detailed analysis. For example, the natural calamities have become very routinely, the frequency is alarmingly increasing. And when we do the impact assessment of natural calamities, that doesn't have much very close focus on impact on health and well-being. How that is impacting on health, that is one of the area of research. How do you measure the impact of natural calamities on health? What are the tools necessary? How do you create enough tools to look at this? And also looking at the economic burden of disease, we don't have enough tools to look at this. Looking at some of the research tools is an important part of research itself. Sorry, I can hear you there.
Yes, sorry, my bad.
Yeah.
So next question is, I'm reading the question as it is. Sir, I am a BDS student. How can I contribute in public health as a dentist?
In dentistry, there is something called public health dentistry. I hope you must be doing that specialization, because the dentistry is actually should be part of the primary health care in any context. Because for some reason, dental care is considered as luxury in most of the contexts. But dental care is not luxury anymore. Dental care should be part of the primary health care. And advocating for incorporating dental care as a primary care, that's one of the major public health contribution you can make, because dental care should be part of the essential primary health care in the primary health setting. Because of the dental disease, that has impact on overall health. So reducing that dental, the intervention in the area of dental health, that can contribute significantly towards general health and well-being. This idea, promoting that idea, the importance of dental care as a primary care issue, in Indian context, if you promote it, that itself is a major contribution. And at the same time, you can also look at specialize in dental public health. Because what is the disease burden contributing towards because of dental care. And dental health is also an impact of the public health indicator. To what extent your dental health is neglected, that's an indicator of the public health burden. That is an indication of lack of information, knowledge about public health. So if you are a BDS student, you are a dental student, advocating for dental care as a primary care, and also looking at your research into to what extent dental care is a primary healthcare need, to how you can integrate dental care into primary care. So these are some of the possibilities of making dental education as more relevant to public health. And I can go on and just giving a very brief answer to that question. Thank you.
So next question we have is, good afternoon, sir. I have completed my graduation BSc in community medicine from Medical College and Hospital in Nagpur, and now working as WHO Nagpur, an external monitor for various health programs as well as COVID vaccinations and routine immunization. So what career options will be good for me to do post-graduation from Australia or other universities? So especially looking for,
yeah, based on your graduation and your exposure experience, looking at the possibility of a master's in public health, so it's a very logical explanation and a logical possibility. And in Australian universities, many universities are offering public health program. But what I noticed is that there are very limited scholarship possibilities of public health. But I quite often I give many my private advice to the public health students, because in the Australian employment opportunities are very, I mean, it's arranged in a student visa and employment opportunities are two watertight compartments. So when you come as a student, I'm sorry, I'm not giving a migration talk, I'm giving a very general introduction. So when you come as a student, quite often you can do other employable skills you can acquire. For example, suppose that there are online courses in elderly care, there are online courses in disability care, and there are online courses on how to manage a diagnostic lab and various lab procedure. You can do it online, and the practice doing it on once you arrive. So with that certificate program, you may be able to work and earn an income. And that income is reasonable enough to pay for your fees. But then those who are trying to get an admission to MPH program, you have to carefully plan for your student visa. And once you come here, you have to think about an employment opportunity before you come here. And you do the preparation while you are in India. You do the certificate course or such courses online before you come here, which will give you employment opportunity. So this is the advice I give many students. I know they come, they do. See, suppose you're familiar with elderly care, you can do 3-month elderly care while you do the preparation for admission for MBH program. By the time you come here, you can do the fieldwork part of that component during your first month of your MPH program. So what you need is, you need some survival income for at least to survive 1 or 2 months. So by the time you are accredited to a job in that particular sector, like maybe elderly care, disability care, so managing an elderly home, those, I mean, I'm just an example. There are many such employment opportunities. So this is a one way, but I'm not giving a very specific advice, I'm giving a general advice. So this is a way, even if you don't get a scholarship, this is a way you survive. And also, see, many people come to Australia with a view to get the possibility of a migration or permanent residency. And within the public health, what specialization you take also contributing towards your chances of getting a permanent residency, because certain specialization got a better opportunity than some other specialization. So that way, carefully planning all these issues is an important part of your career move, or your plan to get a career option in public health. And particularly if you're planning to, I mean, if you're looking for an opportunity in Australia. And remember, what I gave is a very generic advice, generic information, not necessarily specific information for you to take a decision. Which I'll be happy to give that advice to anybody who is interested. You can contact me.
Yeah. Okay, thank you, Professor Sir. So next two questions are very related. So they both want to know, like, from where they should do the master's program in public health.
See, in India, as I mentioned earlier, there are almost 80 institutions are providing public health, masters in public health, various aspects of public health. And also in Indian public health, there are two streams of public health. A public health training for the clinicians and public health training for non-medical graduates. If you're a non-medical graduates, what you do, and the medical graduate, what public health program you do, there is a slight variation. So if you're a non-medical graduate, you have to think about a public health program mostly run in the non-clinical setting, not necessarily associated with the medical college, because this will have learning issues comes up. Because sometimes public health program is geared towards medical doctors. So their understanding and their basics is different from a non-clinician, non-medically trained person. So this is one thing you have to remember when you take up the course and you look at the syllabus carefully, whether the syllabus is geared towards a clinically trained person or non-clinically trained person. This is one aspect of it. Second aspect, I mean, in different cities, there are MPH programs. Look at the cost of it. I would say that's also an important part of it, because in some private universities, the cost is very high. But at the same time, they offer, there are better employment opportunities. So you have to look at the cost, employment support, and the mentoring support will be given by the universities. And also, who are the faculty? What is their public health profile? And whether this faculty is willing to mentor you, personally support you. So you ask around the students who are studying already in those institutions or those public health schools. This is an important part of it. Whether the faculty in those schools, are they willing to support you? Will they go out of their way to support your career opportunities? And they're not just teachers. Will they give the teaching plus the mentoring? So this is one major aspect of it. But if you're planning to look for MPH outside the country, that's an entirely different preparation you have to do. Not what I mentioned. There is a totally different preparation you have to do. But so that way, one thing you have to remember, that the long term, a proper career preparation is important for taking up a job after your graduation with a master's in public health.
Okay. Thank you so much, Professor, for extending the time which I took from you. So we are just last three questions, and then, we will just end it. So next question is, hello, sir. I am currently pursuing Master in Public in IIPHG. So I interested to migration health. So how to connect thesis to topic in research area? I think he want to work with the migration health. So how to connect it or choose it as a research topic?
When you look at linking migration and health, migration and public health, you have to remember there are different aspects of migration. There are refugee migrants, there are internally displaced migrants, and increasingly migrants because of environmental factors, environmental migration, ecological migration. Then this is a major factors contributing towards migration. That's one aspect of research. Then within this, the impact of migration on child health, child mental health, and the elderly care, how the migration is impacting on the health and well-being of the older person. So you can look at population-specific migration and health. Then you can look at the disease-specific, migrants and their cardiovascular disease. If you look at linking public health as a disease-linked one, or you can simply look at what are the services available for migrant versus the other population. And what are the barriers for access to healthcare for the migrants? Because quite often migrants, what happens is that you need some kind of identification, Aadhaar card or some other identification to get access to healthcare. And in many healthcare settings, migrants are excluded, discriminated from healthcare settings. So the migration and health, you can look at as a subject in its totality. You can look at the population, different groups, migrant population, how it's impacting, and different thematic issues, you can look at it, and also financing healthcare for the migrants. So who is financing it, how is impacting, and migrants' out-of-pocket expenditure of health. That's another major area of research. You can link up that. That way, nutritional impact of health of migrants. There are hundreds of issues that can come out with it. And I'll be happy to discuss if you want to have a very personalized research project. If you have, I'll be happy to discuss later on.
Okay. So I think very similar next question is, but this is from a literature student. So she's a literature student and she is interested in the public health. So is it possible to switch from literature to public health?
Of course, look at the health literature, how public health is described in literature. the concept of health and well-being, how it is described in the literature sense. Because the idea of health, this is quite often it's articulated through literature. And how the health is understood by in a community through literature, through our mythology. So you can look at or you can look at how the concept of health is evolved in the literature, or take any literature, maybe look at certain, say, for example, take the case of Marathi poetry. How the Marathi poetry is describing health of the population, different groups. So you can easily link literature and health from a different point of view. One is the description of the health, the perception of health, and also what is the good health that is described through the literature. So that is, there are different opportunities for looking at public health, how it is reflected on literature. Even public health, how it is described in the TV. I mean, in the other media, for example, maybe the popular films, how they look at health, or how literature can be used for promoting health promotion and literature. There's again another area of opportunity for linking literature and public health and experience of health by different people. That's another area of a literature student can explore. Yeah.
And a very similar question is from a BSc microbiology student. And I think Mrunal. So I think for this student, it should not be a problem to move from a microbiology to a public health.
But what I mentioned, there are two schools of public health. A school of public health which is focusing on biomedical aspect of public health, and second aspect looking at social and structural aspect of health. But a student who is moving from a biomedical area to public health, looking at social and structural understanding, that person may have to pick up some aspect of social aspect of health. So this is what you have to keep in mind, that whether you are taking the clinical stream of public health, that what they call it as normally epidemiology or a clinical aspect, or social and structural determinants of health. These two different schools required slightly different preparation and expertise.
Okay. So I guess we are done with the questions here. But I guess, yes, I think world has awakened, was taking seriously about the public health, not just the health for the rich, but the health of everyone. And that's why, myself and Professor Joe, when we discussed last time, so we thought our students also, Nalanda students also should have an idea of what is public health, what are the opportunities. And when we were discussing, I couldn't think a better name than Professor Joe, who has a connection with India as well as the international communities. So, and we can have again a connecting session with this, maybe like some students who want to have a in-depth, higher knowledge about the master's level, research level, PhD level, public health information. So we can have a separate session for them as well in future. And definitely I will request Professor Joe to take some time from his busy schedule. So, and
Dr. Ajay, you can give, if anybody is interested, they can give you my WhatsApp number. You have it with you, and also my email ID and my Twitter handle. That is at Joe Thomas IN. That's my Twitter.
Yeah.
Whichever way you can reach out to me through Twitter, email, and also to WhatsApp. Yeah, please, you can share with them that, because somebody asked how they can reach out here, right?
Yes. I think one question came back again. So I thought it was covered in the slides, but okay, let's see. So this person wants to know the difference between public health and global health.
Can I ask the background of that person? Why that asked that question?
I think it came from the YouTube, because I got this question from my team. So
right, yeah. See, because why I asked that, asked a counter question is that I can give a very simplified answer and I can give a very high level answer. See, for example, today, look at the case of a COVID pandemic. COVID pandemic is a global pandemic. It's a global disease, because the way it is spread, the way it is prevented, the way it is rapidly controlled, all are global. No one country cannot control it. So health is becoming, because the disease doesn't stop at the boundary, national boundary. Many diseases go beyond the boundary. The diseases doesn't come with the passport and visa. So you have to understand health in a globalized context today to understand, have a control on the local situation. For example, malaria control. You may control the mosquitoes in one part of the country, but immediately outside your national boundary, malaria is rampant. I can give an example. I'm not necessarily specifically mentioning any country, but this happened. Our border districts, we'll have a very extensive malaria control, mosquito control program, but immediately outside the other side of the national boundary, there is no such malaria prevention. And the mosquitoes doesn't look for a passport and visa to fly in and fly out of the country. So global health is looking at health from a global perspective. And also looking at reducing global inequity. And health is also unequally distributed between the countries. And increasingly, health is part of the international relationship. Many health issues are, for example, India government, we gave vaccines for about 80 countries globally. So health is used as a diplomatic tool for the countries. And there is in the global health, there is a sub-item is evolving, sub-domain is evolving called health diplomacy. So global health is actually a part of the public health, specializing on global aspect of health. And what are the tools we have to create and to better health? And what are the global institutions? There are major 4 or 5 global institutions looking at the health and well-being of the global community. For example, WHO. The function, role, and the dynamics and the governance of WHO, UNICEF, UNFPA all falls under this issue of understanding global health. Global health, these are the global health institutions. So essentially, global health is a public health, looking at public health from a global perspective in a globalized world.
Thank you, Professor. So I guess we are, so yeah, so the whole thing was very fantastic, and I'm very happy to have you, Professor Joe, with us today. And I would like to thank to you on behalf of our director, Anup sir, and on behalf of our whole team, Digital Nalanda team, to organizing this talk. And I would like to thank you, my sincere thanks, sir. And definitely we will invite you again, because so that you can have same discussion or a discussion at another level with the masters as well as the research students, because this was the first talk we thought he just give an idea what is public health to all our students. But definitely we will invite you again for the similar talks for the senior students as well. So thank you so much once again, Professor Joe Thomas. And I would like to thank all the audiences, students on Zoom and the YouTube, and also, yes, please, sir, please.
And thank you, Dr. Ajay, and thank you all the organizers of Nalanda Academy. And I don't know whether you have a health part of your discussion, whether health is part of your teaching and training. And I would strongly suggest that maybe look at the possibility of focusing on health as part of your overall skill development education opportunity, because increasingly health is going to becoming a major tool for education and training. And your understanding about the population in a broader context. And I understand that you give a special preference for a certain segment of the society. Those societies should have a better grasp on what is health and how that health is impacting on the overall well-being of the society. And you should have students from that particular segment who got a strong voice in public health for the well-being of the population. Remember that when you look at the child death and child mortality, infant mortality, maternal mortality, this is mostly affected by people from a different segment of society. If you look at the social class, people are from a different socioeconomic background, they're disproportionately affected. So from that point of view, Nalanda's commitment to marginalized population, vulnerable population, understanding about health should be part of your overall social response. So this is my request for the institution. I'll be quite happy to contribute to, if you're thinking about it, this is my advocacy towards in public health. And I congratulate your effort to looking at giving opportunity for students from a specific segment of the population and integrating them and ensuring that the benefit of the global expansion, global development is also equally distributed, equitably distributed for the people and students from other segments of the society. And my apologies, I can't speak in Hindi. I'm sorry, this is what I could contribute. And I can never speak in Hindi for a teacher's level. So again, I apologize. And thank you for inviting me. And I enjoyed sharing this. But also let me apologize that I was not sure where to begin, whether it's a high level, a PhD students level or an undergraduate level. I had a little bit of ambiguity about to what level this should begin, and that must have contributed certain level of ambiguity about my presentation. If you can, I mean, if you're interested in future, we can have very specific topic and take it, and also we can discuss in future as well. And I appreciate very much Dr. Ajay's contribution to this particular population group, and also your dedication to the people who are marginalized and also socially excluded population. Thank you very much, and have a good evening and good night.
Thank you, Professor Joe. Okay, so I declare that now we can close this event. And so thank you, Professor Joe, and a very good night. Okay, and thank you everyone for attending. So yeah, we can. But before leaving, I will just drop Professor Joe's email there so that some people can see. You can do that later also.